So, Gwen, when did you notice that things were not exactly right?
I believe it was around 2009. I noticed there was a tremor in my hand. At first, I didn't think much of it, but then it didn't go away. So I decided at that time I should probably see a neurologist, and I made an appointment.
And what did they say after you made that appointment?
They did some testing, and after the test came back, they do an MRI usually to make sure that you don't have like a brain. It's sort of a process of elimination. There is no test to tell you you've got Parkinson's, but they did the MRI, they did a cognitive test, they did an EEG on me. And when all those came back, he made an appointment and told me that I did have Parkinson's disease.
And what was your reaction?
Well, I'm a nurse, so I kind of had a feeling that that's what it was, so I wasn't surprised.
But so that's a lot to take in.
It
What
was. It
was
is a lot to take in because it's a chronic illness, something I'll have for the rest of my life.
what was the suggestion as far as treatment?
The first treatment was medication, of course. It was a medication called Azilect, which I don't believe they use too much anymore because they felt it really didn't do much for you. It was supposed to prevent you from getting worse. And then I think year 2 or 3, they started me on the carbidopa, levodopa, or Cinemet, and that worked very well. And over the years, I just had to take more and more of the medication until like every 2 hours I was taking it, and it was hard to control my symptoms.
What were your symptoms?
Of course, the tremor in my hand, and then it went to the arm and the right side, my right leg. It was on my right side at that point. Slowness of movement, unable to smell. That's one of the symptoms. Loss of balance. So those are some of the symptoms that I had.
And over time, you mentioned it did progress. You were taking
Yes,
a lot of
a
medication.
lot more medication. Yes.
So, what did a neurologist suggest to you?
Well, during my appointments, he started to suggest, I would say, maybe a 5th year or whatever, he would start to suggest that I have the DBS surgery at Penn State. And I was very nervous about it, leery about it. To me, it was brain surgery and it was something scary. And so I kind of put that off until it got to the point where I was taking my medicine way too much and it was making me nauseated, and my life was not what I wanted it to be. So I decided to have the surgery. I talked to a couple of people who had it done. That helped me tremendously because that kind of made me think, if they can do it, so can I. So I decided to have it done.
Talk to me about the process. How did it go?
Oh, it went very well. It's a 3-part procedure, but the most invasive part would be your second surgery, where they insert the electrodes into your brain. And then the third surgery is where they put the generator in your chest and they hook up the wires to the generator. And then once that is done, then I think in 2 to 4 weeks, they program it and then they turn it on and try to get your symptoms to where they're much better.
How did it work for you?
Was like night and day. It really has been a blessing, a real blessing for me. I'm able to do pretty much anything. I only have to take my medicine 3 or 4 times a day, where I was taking it every 2 hours. It's just been a real blessing. And I just want to let everybody know that it sounds scary, and brain surgery is no easy thing, but if I can do it, so can you. And I wish I would have done it sooner. I really do, because my symptoms are so much, especially my tremor, that has really, gotten a whole lot better.
Oh, that is wonderful to hear. So glad that it made a difference for you, Gwen.
Oh, very much so.